Hi, everybody, and welcome to the 2020-2021 season of IPHA's Third Thursday Lunch and Learn web series, organized in part by the IPHA Education and Programming Committee. We at IPHA dedicate this time every month to sharing our successes and even some of the detours it may have taken to get here. The point basically of this Lunch and Learn web series is to be able, as public health practitioners, to connect, to learn, and to strengthen the voice for public health in Iowa. So we're glad that you're here with us, and we hope that you'll be back with a friend next month. We always start out that way because we're happy you're here, but we also look forward to you joining us again next month. Today, we have an interesting session planned. What we want to do is really to engage with students that are working with practitioners, either through internships, through practicum projects, through other kinds of projects. And so we're going to have a panel of students that we talk to. But before we get to that, I have just a couple of housekeeping items. Your microphone is muted and your video is turned off, sort of, by the administrator during the presentation. And basically it's so that we can have the speakers, you know, kind of take up the bandwidth and we can hear from them more clearly with a lot of background, without a lot of background noise. You will be able to unmute yourself and turn on your camera during the Q&A portion of this webinar. And you can also feel free to put questions into the chat or into the Q&A feature at the bottom of your screen in Zoom, because we definitely want to be able to keep track of any questions or comments that you might have and share them along with everybody else. This session is being recorded and will be posted to the IPHA YouTube channel after the session is over. So we've had all kinds of interesting things happen this morning with regard to our panel. So Lena, maybe if you want to jump in to begin with to tell us a little bit about who we have with us.
You bet. Thanks so much, Angeli, for introducing us and kicking off this Lunch and Learn. For those of you who don't know me, my name is Lena Reinders. I'm the Executive Director of Iowa Public Health Association, and we're so happy that you're here with us today. Hope you'll join us every month, the third Thursday, for Lunch and Learn. And I always have to put in a plug for IPHA membership because we are a member-based organization. And if you're already a member with us, thank you, thank you, thank you. We love having you as members. Our mission is to unite and strengthen the voice for public health in Iowa, and that's what we're doing every day, including with this session. So if you're not a member, I do invite you to join. You can do that at iowapha.org. So today with us, we do have Julia Reichert, who is a student. She's a senior undergrad at University of Iowa. She was an intern or a VISTA volunteer. I'm not supposed to use the word intern, but so, she worked with us this summer, did a great job helping us out. And as soon as class is over at 1/4 afternoon, Bekele Ikobo will be joining us as well to talk about her experience. She was an intern with IPHA this summer and still is for another few days via the Midwestern Public Health Training Center. So we have Julia and Bekele that will be joining us, and then we have several students from DMU that are on the call with us today, and we'll do a short presentation or kind of conversation with Julia and Bekele, and then what we want to do is open it up and just kind of have a conversation and hear from all of you what your experiences have been as a student in public health. Anjali and myself, Janine, other people on the call, we did our public health training when the idea of a pandemic, though very real, was more of an academic exercise, and you all are living through it. So we want to hear from you how that is shaping your idea of public health and your career path. So with that, why don't I go ahead and turn it over to Julia to introduce yourself, and then we'll start the chat.
Hi, I'm Julia. Like Lena said, I was an AmeriCorps Vista volunteer with the IPHA this summer. I'm in my final year at the University of Iowa getting a BA in public health. See what else about me. I'm still a part of IPHA, working with them a little bit with the communications committee and the membership committee. Sometimes I'm in and out and all around. Having the opportunity to sit in on most meetings this summer made me very much not willing to leave. So I am still here, still hoping to work on a couple of projects with the IPHA. But, yeah.
And we are grateful that you're still here, Julia. Do you want to talk a little bit about what was it that kind of drove your interest to doing a summer of public service, which is what AmeriCorps Vista is, and how you found out about IPHA and kind of what attracted you, what piqued your interest with IPHA, and then also kind of what we did together.
So like most students, my original plans for this summer were put on hold. I had an opportunity set up to study Portuguese in Brazil, and that all fell apart in the very beginning. But I started looking through AmeriCorps because I had originally heard that they had opened up a bunch of COVID relief-based programs. And I actually originally had applied for a different one, but the lady that I was working with referred me to the IPHA position, saying that it looked like it would really fit well with my resume and what I was looking for. So I very much appreciate her doing that. I originally found out about the IPHA when I attended the legislative forum last year. I got an email through the College of Public Health saying they were planning to sponsor a few students to attend. I applied to go to that, thinking it would be more so an introductory thing. It ended up being me and I think 2 graduate students and a PhD student, which tends to be the case when I just sign up for things. I'm the smallest fish in the pond, but that's okay. And that was a very informative experience for me. Got me looking more into health policy work and really gave me a better understanding of what all the different careers in public health can look like and how public health professionals can come together and work on projects together. And it was just really great to see people stand up and talk about what issues were important to them, and then during break times see all these people flood to them saying, oh, I can help with this, oh, we can talk more about this. And I think that was the first time that I saw how collaborative public health can be. And so I was drawn to continuing to be a part of the IPHA because it seems like a great place for professionals to come together and me to participate, but also just listen and learn from a lot of people that are doing the work that I hope to do, I guess, very shortly now. That's crazy, but yeah, that answered your question, I think.
Yeah, well, one of the projects that Julia and I developed and Julia really led the effort on was trying to collect the stories of COVID in real time. And so we set about to try to do some interviews with local public health directors and others in the field to capture this lived experience that none of us have been through before, but we definitely all need to learn from. And so, Julia, do you want to talk a little bit about that, what that experience was like and kind of what you learned from talking with different people?
Yes. So that experience now more than ever is very interesting. I now work as a contact tracer with Johnson County Public Health. So now talking to individuals in the community that have tested positive or have been exposed to COVID after speaking all summer with the people that we're working on keeping these people safe and making sure that these people had the resources that they need is very much full circle. I think I had very little understanding outside of kind of a couple of bullet points on PowerPoints in class about how different the rural experience is in Iowa in terms of public health departments and the resources that are available and how hands-on it can be for a few people working in a singular office to manage a pandemic. So on one hand, I could hear how tired people were and how hard this period has been, but also it gave me a lot of comfort knowing these people were in charge of the pandemic response. So it was really great to speak with all of them and get their feedback. There were a lot of central themes of community organizations coming together during this time, people saying that they had never worked more closely with other people in the community before, and they're hoping that these partnerships will continue. So that was great to hear. Obviously a lot of other themes of a wish list that they could get from the State Department in terms of funding and different things. But I really learned a lot about what it looks like on the ground for the people that all of a sudden were in charge of something and tasked with making sure people felt safe and were being safe.
And would you say that has that experience and kind of learning what real public health is like on the ground during a pandemic, I mean, would you say that that has fortified your conviction to working in public health, or has it made you a little bit nervous of entering the field? Kind of how is this experience going to play out for you, you think?
I mean, I'm in public health for the long run. I very much enjoy it. Definitely, I am a little nervous. I mean, hearing people that are in the positions of, I guess, caring for the greater community, admitting like, we've never done anything like this before, and all of a sudden it's our job. And I kind of always knew that was a part of public health, and that was something I was drawn to. I mean, there's always a challenge. There's always something new that needs to be addressed and taken into account. But recognizing the fact that someday I might be one of those two people that all of a sudden is in charge of the next steps for a whole county for the health of a larger group, it was humbling and kind of was a real life example of the things that I have always talked about in class. But no, I'm not changing anytime soon. I'm very excited to eventually enter the workforce, pursue more degrees, all of that fun stuff.
That sounds
Julia,
good.
Julia's kind of a follow-up. Do you have some ideas or some areas of what you might be interested in doing next, or kind of what path you're thinking of?
In terms of education or post-graduation?
Both.
Okay.
Well, so, are you considering going right into a master's program, or are you going to be doing some work? What do you see as your trajectory?
So with the opportunity I had set up for last summer, it was through the Boren Awards. So they have pushed that to this summer, and I'm still eligible for that funding. So who knows, but if that is a possibility, I will be on the first flight to Brazil to take advantage of that. And then following, I think I would like some work experience. I think that's another thing that this project has kind of showed me that, I mean, I love academia. I've always loved school, and I could be so excited to go to a next series of classes as a master's student. But I also feel like I would bring more to the table if I had a couple of years of work experience, and I think I don't even know what questions I need to ask at this point in master's courses. So I would love to get some kind of job somewhere. We'll figure that out when that comes. But in terms of areas of interest, I entered public health from the more social work side of things. That was one of my original majors, one of 8. And I'm very much interested in adverse childhood experiences, violence prevention, dealing with maternal and child health from those kinds of issues. So we shall see.
Just one other question before we move on. So in looking at sort of who else has joined the call, there are a lot of folks on this call that would be mentors. So, either they're in academic institutions, or maybe they're in organizations and they're kind of in leadership roles. My question for you is around, thinking about how we can get more undergraduate students to kind of come out and try out, organizations, look for that real life experience. What are some ways that we could sort of I don't want to say market, but market, you know, the opportunities that we have to students at the various colleges and programs around the state. What are some things that students are looking for, or ways to kind of engage students in IPHA, but in some of the other organizations as well?
That's a great question. I think as an undergrad, there's always kind of the initial instinct to think that you're not qualified to do things. And maybe that's just me. I'm sure there are other people. I mean, especially when it's dealing with things of public health, dealing with people's health, dealing with like sensitive topics. I don't necessarily think it's a bad thing for less experienced people to be like, I don't know if I can handle this yet. But in terms of seeking out experiences, I think that in terms of comfort level of students, I mean, for me personally, it's a like learning opportunity first and then a working opportunity. So with the IPHA, I went to the legislative forum, and from there I was like, I would like to be more a part of this organization. I can tell that they want feedback of younger students. They want to hear about our perspectives. And I think in terms of pursuing opportunities, whether it's research, whether it's internships, whether it's working in an office somewhere, a lot of that starts with a learning opportunity first, whether it's seminars. So I think the students that do seek out going to these events, going to these seminars, this and that, will be more likely to reach out for mentorship, for opportunities, especially if it's, I mean, we always appreciate when at the end of a presentation, it's like, come find me if you have more questions, or if you're interested in this, or if you want to learn more about what opportunities in this field could look like. Sometimes a sentence like that at the end of a lecture can be the difference between thinking that there's space for you and thinking this is something to aspire to someday.
Great, thank you.
That's great feedback, Julia. And something that we, you know, I'll make sure to remember, do my best to remember whenever I talk to students, is to make sure that we are welcoming, because that truly is our intention. So I just see, so Bekela was just able to join. She's between classes. So thank you so much for hopping on. And I want to introduce Bekela, or allow Bekela to introduce herself, as well as Deborah Thompson, who is an IPHA member and one of the co-chairs of our advocacy committee. Deborah was the mentor for Bekela for this summer, and Bekela has just done, like Julia, amazing work, particularly with the advocacy committee. So Bekela, do you want to introduce yourself and kind of talk a little bit about some of the opportunities that you had with IPHA this summer?
I would love to. Hello, everyone. It's so wonderful, well, to see so many boxes as we are in this Zoom world, and to see some faces too. But yes, so my name is Bekela Ikoba. I'm a second-year Master of Public Health student at the University of Iowa, specifically in the Community and Behavioral Health Department. And yeah, I would say it's been really a joy to get to work with the IPHA Advocacy Committee under the mentorship of the wonderful Deborah Thompson. Yeah, and it's just been a joy. It's been a joy. The summer has really allowed for a lot of opportunities to do work that was really new to me, and it's provided the opportunity to do a lot of learning, I will say. So I think kind of the thing or item that's taken or that's involved the most work or effort has just been our continual work on one-pagers, or these one-pagers for our legislative committee. So these have entailed, one-pagers on the topics of immunizations and vaccines, on the state of public health in Iowa, and a variety of topics, and have just been really valuable opportunities, not only to become a better writer myself and to learn how to communicate complex or maybe potentially often misconstrued or not well understood topics for the public into manageable, easy to communicate pieces that can really be tools for advocacy in the future. So it's not only allowed me to be a better communicator myself, but I'm grateful and excited because it will be a tool that's hopefully able to be used for other people and to empower other people to be better advocates in the public health field, which is really, really wonderful and cool. So, and what I've most been excited about this summer. Yeah.
It really has been great working with you, Michaela, and you've brought great insight into the work that we do as well. And I love that through IPHA and through the network that we have of our members, there's different opportunities for mentorship like that. And so Michaela was an intern through the Midwestern Public Health Training Center program. So she got to work with Lori Wachner and Hannah Schultz there as well. But really it was Deborah Thompson who was her primary mentor for the summer. And so Deborah, if you could just share a few words of why you feel it's so important to mentor students.
Thanks, Lena. Yeah, I would return the same kindness to Michaela. It's been a wonderful thing the universe did to pair the two of us together in a time like this. It's a reciprocal relationships. For as much as she has learned from me about public health, I've learned from her about where our future minds are. What they want in positions as they leave their academic setting. And I have communicated that to whoever will listen over and over again. Interns to me are how I have been as successful as I've been in my career. At the department where I spent 8 years working as a legislative liaison for the Iowa Department of Public Health, it was just me. And I know a lot of you can identify with capacity issues. Having interns, having their energy, having their products that they've created has actually just maximized my ability to generate information for people. I'm kind of an information broker, and that's why Michaela spent a lot of time on one-pagers with me. I've had students from Iowa State, I've had 2 from Drake, I've had 2 from the University of Iowa, and now I'll have some experience with Simpson with the new intern that we brought on. And I cannot say enough for the amount of talent that all of these institutions have. And all I had to do was take the time to train them, and they will just go with it. You give them some empowerment, you give them some basic understanding. Here are the resources. So Michaela never left a meeting with me without me giving her at least 3 websites to take, to take on and explore herself. But even on a personal level, though, my ego is so well fed. I can't, we all need a boost sometimes, I think, in our own, and my ability to talk about the things that I've been able to accomplish, that, the world as Deborah Thompson sees it, is really invigorating for me as a mentor as well. And I know we're not supposed to talk about our egos, but I don't know. I'm from Texas. We don't have the same rules as you Iowans do, but that's what's really fed. So it's a reciprocal energy that I find myself needing. And I've never been disappointed in any of the interns I've ever had. And Michaela is by far, I always have relationships afterwards, and I do not see that ending. So Michaela and I will actually be friends for the long haul, just as I have been with all of the interns I've ever had.
And I think that's such an important kind of bonus to internships and mentorships and session. And one of the great things about IPHA as a network is that we do have members across the state, and the ability to connect and form those relationships and those friendships that extend beyond colleagues. And so what I want to do is thank Julie and Michaela. I know Michaela has to get off to class. That's the other thing working with students, right? So there's always competing schedules. But we do have at least four DNU students with us today that are on the call that Now, Julie and Bekele were both interns or Vista volunteers with us for the summer, but we know that there's plenty of students that are entering their public health space, or maybe transitioning from a different career, or having public health as an add-on. And so I'm happy that we have the DMU students to join us. And I'll quickly introduce them, and then turn it over to you all to kind of introduce yourself and maybe talk a little bit about what is it like to be in an academic program studying public health during an actual pandemic that we are all living through, and kind of making up the rules as we go. And I don't mean that flippantly, because we rely on public health evidence and research and science, but this is a novel virus, a novel experience for all of us. So we have on the call Juliet, Ben, and Rachel. And thank you to Janine Moody for inviting these students to join us today.
Matter what order we go in?
Nope.
go ahead, Rachel, jump right in.
Okay. Well, hello everyone. My name is Rachel Doggett. I'm actually a practicing physician assistant at Des Moines University right now, and I do a little bit of part-time work at urgent care as well. So when I started back at DMU, it became very apparent that I was interested more in health disparity and the global health aspect of public health. And then, of course, the pandemic started, and I thought, wow, this is a good time to get involved, because I want to better understand this for the public and the community that I work with and the patients that I work with. So, so far, I'm just in my first couple of weeks of starting the program, so I'm very new at the public health side of it. But I've really learned so far the interprofessionalism and the teamwork that has been involved in public health over a relatively short amount of time since the pandemic started, when all things are considered. And I look forward to, as a provider and also having some public health experience and education, to create and develop maybe some ways to help with contact tracing through our clinic as well.
Fantastic. Thank you so much, Rachel, and welcome to the call. Welcome to IPHA. I don't know if Ben or Juliet wanted to share.
This is Ben Williamson. I'll go ahead and start. So yeah, this is my my second year as an MPH student. I think one of the really interesting things about our current situation is seeing how public health resources across the state and across the country, right, are kind of split between what we've traditionally our traditional responsibilities as public health professionals, and now also responding to this pandemic. And so that has been really interesting to follow over the last year. I think I think as a student, it's provided some interesting context through which we can look at some of the things that we're studying, and also provided the opportunity for some really valuable projects for students and interns, undergraduate and graduate students alike, to get involved in the public health sector and help out with everything going on. I think that has been one of the major differences or takeaways from everything that's going on right now.
Thanks, Ben. Great perspective. And we're so happy that you're able to join us. And I think we maybe had worked together in it when I was in a different position, with maybe some research with Dr. Duffy as well. So it's good to see you again.
Yes.
And we also have Ben and the second Ben and Juliet on.
I can go. I'm Ben Ulrich, and I'm also a student. I'm in my third semester at DMU. So I'm currently working with Jones County Department of Public Health. So it's a county of about 20,000 people. So it's really neat working with like a very small rural area. And I think what's probably been like the most unique thing about this so far is, it just came to my head when you asked the question, was I remember my first class of this program, we watched like a fun little video where people went around asking just citizens if they knew what public health was and seeing how many people did know. And now I feel like you couldn't get away with having someone say, I have no idea what that is right now, because it's so important, and it's really, really neat going through this program right now, especially because you get to see and witness just how big of a role public health has in the lives of people, and just so many people too. Just like we're working with everyone in the country to try, like you said, provide recommendations as we go that are still backed up by evidence and disproving theories and things that people might try and come up with, and just trying to put forth the best effort on recommendations of what we can do to help people the best we can. And so I specifically do a lot of the contact tracing with Jones County, and it's crazy just talking to so many people that just don't know what to do, and they're very concerned. They're like, I don't know who to go to. I've heard something from someone, and I've heard another thing from someone else, like what's right? And I think just hearing the words like Department of Public Health really puts a reassurance to them when we like give them our recommendations on like, this is what the state recommends, like you do. And I think it really helps calm like a lot of people down, or gives them just a lot more reassurance of like, okay, like there is someone we can go to. And so I know something I've been doing is I have a work phone, and I'm just like, hey, if I don't pick up, like, please call me back. And, if I don't know the answer, I'll get it to you. And just the amount of people that like just being that personable with them and going above and beyond to try to answer their questions like we're doing is just means a lot. And so it's a lot of fun to do that and just really go through all of this. I guess it's not fun to like, we're going through the pandemic, but like to be doing this while something so major is happening. It's really eye-opening.
And you bring up a really good point, Ben, about how, we're all watching this sort of happening on the national scene, but that we have so many students, who are actively involved in contact tracing and are interacting with people around the state to not only find out, to obviously serve a purpose and help in contact tracing, but just to hear about what's happening in their communities, to show them that, young upcoming students are getting involved in public health, that it's not just something that's happening far away, it's happening right here in Iowa, and that they're part of it as well. Excellent. Lena, did you say we have Juliet?
Yep, Juliet.
Yes, hello. My name is Juliet, and I was able to, through this pandemic, get some experience working at the Polk County Health Department with Deborah Thompson. She's the communicable disease supervisor there. And so for me, the pandemic has been a godsend because I'm interested in infectious diseases and pandemics. And so I was able to use this horrible thing that has befallen on us to learn a lot about public health response and mitigation at the county level. And in terms of school, like my master's program is online, so it hasn't really affected me much in terms of like changing schedules and all that. But to me, it has been a great learning experience, and I garnered a lot of, I was able to both my internship and capstone there, and I'm still working on my capstone, dealing with the COVID-19 mortality data for the county and analyzing that and seeing trends from March until now.
Excellent. That is very exciting. Wow, you are deep in with some of the data. And you bring up a good point that, students are looking for all kinds of opportunities. Julia mentioned this also. Sometimes it's, a short-term internship. Sometimes it's a practicum project that's a little bit more in depth, or shall I call it the applied practice experience. And sometimes it's work. And so I think that there are a lot of opportunities, and those of us that serve as mentors can think about that as well, that it doesn't have to be, some really big, well-developed thing that we need a student to do, sometimes it's, you know, a smaller project, or it develops over time into something larger. So there are a lot of opportunities out there that people can get involved with. I also want to point back to something that Deborah Thompson said about many of us have been working in public health for a long time, some of us longer than others. And one of the really exciting parts about working with students is to hear the fresh ideas, to hear, you know, their idealism, their, you know, how they view public health and how they view that this experience as an intern or as a practicum student can inform their career. You know, that it's exciting. You know, we're kind of thinking of it from, well, we've been doing this for a long time. We know a lot of stuff, but you youngsters really bring a lot of fresh air and light to the work that we do. So that's exciting.
And I think too, and Anjali, as many have spoken of, public health is like a lifelong learning profession, because things evolve, because things change, because we have novel viruses, because we learn and we adapt, and policies change, and our understanding of public health changes. And so one of our lifelong learners is on the call today. She kind of has a foot in both the mentor, mentee, student, professional side of things. And that's Janine Moody. Janine helps oversee the student experiences at DMU, but she's also a PhD student herself, studying specifically leadership in public health. So Janine, do you want to say a few words about what your experience as a student has been after, you know, decades in the career?
Right. When I got my MPH, we barely had the internet. So
I've got you beat, Janine, got you beat.
Okay. Yeah, so I am a student at the University of Illinois, Chicago, working on my doctorate in public health leadership. So to view this pandemic through a leadership lens is really challenging. It's a great opportunity. It's really shifted me to thinking about the whole reason I wanted to pursue this degree is not for the degree so much as for the skill set that I felt like I needed. I just feel like I've spent 20 years in Iowa, and we've been churning over some of the same issues for 20 years about our public health system, about disparities in capacity and capability among different health departments, and really the need to function as a system. And so all of that is split wide open for the world to see right now during COVID. And so always honored and amazed by the leadership that happens at the local level, and the innovation, and needing to draw on the public health network. But as a student specifically studying public health leadership, also dismayed and concerned when we have an absence of leadership, or when we have shifted to political determinants of health, even more so than social determinants of health. So I'm presently doing an environmental scan of our Iowa public health system, and really looking at some of these issues, and doing some key stakeholder interviews, and learning a lot, and trying to piece that picture together. So it is very exciting and humbling at the same time.
Excellent. Excellent. Lena, I wondered if we have quite a few people that are on this call. Many of them have worked with students, or you know, hosted interns or practicum students, and so on. Was thinking maybe we could open it up a little bit, either for questions or for comments about some of the experiences that they've had with students, ways that people have gotten students engaged in some of the work that they're doing.
Absolutely, that would be great.
I'm also taking a look at the chat to see if we have any questions coming up here.
Yeah, we have about 10, 15 minutes that we have left on the call before our next Dare to Lead session. I have to open that in the Zoom window. So like I said, always learning, always about leadership and and vulnerability, and how do we be brave leaders in the midst of a pandemic. So well, yeah, let's open it up, and anybody can feel free to unmute themselves and kind of share your experience or vision for public health from a student perspective.
Hi, this is Kelly from Cerro Gordo County Public Health. And I would just like to say that I work with students on a regular basis. And one way that we've incorporated our students is they've been helping us to put flu clinics together to get a mass amount of people covered at one point. So that's been nice to have their help with that. As well as this pandemic has offered some insight into dealing with those who are in poverty or not as fortunate with transportation and things like that. I always like to talk with my students about those who are less fortunate and don't have, the tools that they need to be well. So it's always a great opportunity to talk to them about poverty and how to deal with that and to be less judgmental sometimes in that area and to think about the other challenges that they have in dealing with COVID than other people may have.
Absolutely. COVID has shown us, if nothing else, how intertwined our health and communities and education, transportation, employment, everything is. Thanks, Kelly. Others?
Hey, this is Ben. I think Ben Williamson, I should specify because I know there's more than one Ben in the call. I think in addition to one of the things that this pandemic has kind of provided us as public health professionals, the opportunity to do is take critical inventory of the systems by which we collect and interpret and analyze public health data and then use it to kind of craft our response. I think a pandemic of this scale really kind of pushes the limits of how all players in the healthcare industry collect data and use that to operate effectively. And so I think if anything, this is an opportunity for everyone to look at how we use data currently in our roles and whether or not we can do things to make that usage more effective or expand opportunities to collect data in a more effective way.
Great point, Ben. That will be really important. And I think that especially not only as we go through it, what kind of systems do we have in place, but at the end of it to say, okay, what can we be doing better? How can we be really using the data in novel ways and ways that can inform what we do and can inform our leaders, back to Janine's point, on what needs to happen. Excellent point.
Absolutely.
I actually kind of have something unique to follow up with that. This is Ben Ulrich, the other Ben in the chat. I'm currently in a class right now talking about like the integration of primary care and public health and how important it is. And just I know, especially in the role I'm in right now, I feel like I see that more than ever, and just made a report on it for my class, actually, just talking about how there's some confusion still going on, especially such a small area where, the primary care providers take on so many people in just one little county, and accidents happen and where people get incorrect information about their test results, and it can really frustrates people, confuses people, scares them. And then just thinking about if we had a better form of just way to share data, just integrated data system of, there'd be more effective communication. We wouldn't have to waste time, contacting people again that have already been contacted, and just I think time, manpower, and just things could be done way more efficiently if we had just more systems that were working together to try to combat this.
Thanks, Ben. That brings up a really interesting idea of the opportunities that could come from this for like public-private partnerships, or ways that we could work with other types of systems or institutions to improve the communication of data, of information.
Yeah, especially right now too, with like, I know in our area specifically, a lot of schools are having their own forms of contact tracing and just rules, and certain places of employment have their own rules on when people can return to work, what they require to return to work, and just all this, the differences in rules really just confuses people on when can I be done with my quarantine? Well, work says this, health says this, and just have, I don't know, seeing one form or one system I think would be more effective, but that's just what I've seen so far in my limited experience.
I think that's a great opportunity for Anjali. I don't know if you'll do it or not, but I will plug for you your data viz class. I'm going to mess up the name. The bite snack meal approach to data visualization. How we use data for storytelling is so important, especially when we're communicating with the public, when we're communicating at our elected officials. I mean, numbers are great, and we have to always have the evidence behind us. But storytelling is so powerful, and when we can put real life people and stories to the numbers, it just makes it so much more powerful.
Yeah, I think so. And that combined with also the action item, you know, so like, what is it we want people to do? What is it that they can do to take control of the situation? And the many different audiences and stakeholders that we have at the table. This is also a really unique opportunity to be sure that we're bringing other sectors and we're bringing other partners in, because, you know, we can see through this pandemic, there's so many different effects. Health, of course, being one of them, but housing and employment and education, and how can we be doing things differently? So taking the data that we have, that we're pulling into this, and then being able to communicate it back out for action.
Yeah, I want to chime in on that too, Anjali. The piece about cross-sector opportunities and students, I think students have a real interest in that. And given our Public Health 3.0 approach, I love that. And I'm seeing Ed Marino on the line, and thinking back to when we were working on water fluoridation and how we needed to work with water operators. And they became part of our public health community, and frankly have always been protecting our water supply, right? So I have a student right now who is working with the Iowa Primary Care Association, and they are working on planning a new campus that would also include housing for clients of the Community Health Center and the FQHC. So I think that the more opportunities, either folks who are here on this call who are practicing in public health and would host a student, but think about opportunities for students to help make those bridges cross-sectorally. I think those are great opportunities.
I'll just chime in since you called my name. This is Edmund. I look back on my career, and I was introduced to the water industry through a professor of public health at the University of Iowa. So I was a student operator, and there was a great opportunity to kind of see the impact of public health in the mission of that industry. So Neil Fisher, project manager, or I should say general manager for the University of Iowa water plant, which still has a student operator program. When I was at Iowa City, we created a student operator program at the Iowa City Water Division. So students from public health, engineering, et cetera, can be mentored by working as operators over the weekend that has been approved by the Iowa Department of Natural Resources. So that's one expanded opportunity that students could look at in public health. Also looking at things like some of the service clubs. So Lions Club has a diabetes initiative that they're starting to get into real strong. LULAC, League of United Latin American Citizens, has a lot of issues related to health for people of color. So there's a lot of opportunities out there for students to get experience in the real world.
Excellent. Lena and Deborah, if I could, ask one of you, I know that we have some trainings that are coming up in November around the topic of advocacy. I feel like that is something that students really need to get some training and experience in, and I'm sure that there are practitioners around the state that would like to hear more about it. Could one of you do a plug for that event?
Yeah, Deborah, do you want to go ahead and give the dates on that? And then we're going to have to, unfortunately, cut the conversation short. I know we could talk forever. But one thing I need to learn to do better is to give myself a 15-minute break between Zoom calls. So Deborah, quickly.
Okay, yeah, we have November 17th, we will do a training day for legislators fresh off the election, to learn more about public health, and then also for public health practitioners to learn more about advocacy. Then we'll have our legislative forum on December 2nd. And then I will be in the last lunch and learn on December 17th of the year to talk more about election results and what will probably sound like a desperate plea for help from the public health community to, because I think that public health will absolutely be top of the mind, and I want us to be prepared for whatever is about to happen in the 2021 session.
Excellent. Thank you, Deborah. And you just heard Deborah plug the December Lunch and Learn session. So I'll fill in the gap and say that in November, on November 19th, we have a session. Thank you, Lena. See, this is like a team effort. This is public health at work. So on November 19th, our third Thursday Lunch and Learn topic is going to be opportunities for leadership development within IPHA. So there's more on that will come up.
And I'll give a little bit of insight into that one. Really what one of the things that we're doing is our board elections are coming up. And so IPHA as a membership organization is governed by its board of directors. And our board of directors are made up of and voted by our members. And so anyone who is a member of IPHA for at least a year is eligible to run for a board of director seat, and that includes students. I would love to see a student on our board. Technically, we do have a student on our board. Shelley Horak is another doctoral student, and she's on our board, but she is leaving. She's terming out this year, and so we will have 4 open seats on our board this year. And so this will be, you'll start seeing us pitch applications for the board of directors soon. So even if you're a student, I know Julia said she doesn't always feel qualified, but you are, because we need to hear your voice. So this session in November will be about leadership opportunities from the board to committee leadership to all sorts of opportunities.
Excellent. Thank you very much. So we are coming to a close of this session because, yes, we need a few minutes before the next 1 o'clock meeting. But I wanted to thank all of our panelists, the students who took time to be part of this session today, to share their experiences and what they're looking at in their careers. And thank you to all of you who attended and shared your lunchtime with us. You've already heard about our next session for November and then again in December. So we look forward to seeing you at the upcoming 3rd Thursday Lunch and Learn sessions. The IPHA Education and Programming Committee is continuing to plan events for the rest of the year. So we welcome your ideas for future Lunch and Learns or for other kinds of trainings that you think or webinars that would be important to folks in our community. I will just hit on what Lena said at the very beginning. As a nonprofit organization, IPHA relies on membership dues and sustaining donors to support our mission. So if you're not already a member, please consider joining IPHA. And students, any students that are out there, please check in with your programs to see if they have funds to support your membership. I know that at the University of Iowa, we have done that historically, and I'm sure that that's something you can talk to your faculty about. If you are a member, thank you, and we appreciate any donation that fits within your budget. You can join and give at www.iowapha.org. And and we have our recordings, they'll be posted on the YouTube site. I guess the last thing that I'll say in closing is, if you haven't already voted, please get out and vote. I won't tell you who to vote for. That's your decision. All I can tell you is get out and vote if you haven't already done so. Thank you all for attending.
Thank you, everyone. We'll see you next month, if not sooner.